Well, thank you for the opportunity to be with you. I'm here to spend the next 45 minutes or so going through a strategy around the rural healthcare workforce and using some evidence-based methods and improvement methods to solve some problems. So first, I am the president and CEO of Hutchinson Regional Healthcare System, which is a regional medical center in central Kansas. And our service area is about 100,000 people, 30 zip codes in central Kansas, just northwest of Wichita. We do also care for patients all the way out to the Nebraska, Oklahoma, and Colorado borders. So, as a regional center, we care for folks all the way out there, but primarily in this service area of 100,000 folks. We have an aging population, as I said, just under 100,000 people, and largely older. So we take care of quite a few Medicare recipients, and as part of our population, we do capture the vast majority or the majority of our market share, or the Medicare market share in our community. There's really nobody else even close as far as competitors. They really the remaining amount is split out a bunch of with a bunch of small amounts to neighboring regional hospitals. We own, as I mentioned, 51% of the Medicare market, and the expected growth from our system will come from within Hutchinson and in McPherson, which is a nearby county, with a relatively strong payer mix because of the presence of a large uh, um, pharmaceutical company that is there. 85% of our growth will come from folks that are 65 years or older. So a little snapshot into where we were coming out of COVID. Uh, this organization did not weather COVID well. The left without being seen rate was greater than 5%, so even as high as 9% at one time, almost 1 in 10 leaving without being seen. Our balance sheets hadn't been reconciled in 10 months. Our financials had not been, our audited financials were not approved until 6 months after the end of the fiscal year. And that was a buzzer shot on New Year's Eve. We were the only hospital in Kansas to achieve a leapfrog score of F in Becker's Healthcare, which is not the reason we want to be in Becker's. Our EBITDA was negative 12%. We were out of compliance with bondholders and at risk of payback. We had over 50% of our practicing physicians at HRHS were living outside of our county, even as far away as Tulsa, Atlanta, Dallas, Kansas City, coming in for shift work. Our team member engagement scores were 7.4 out of 10. And our domestic utilization of our own health insurance plan with our own employees was 50%. 50% of our own employees were choosing to get their health care out of town. So quite a place to start. But there we were, and that happened to be my first or second month with the organization, but we inherited that. So what we started thinking about is what could we learn about growing people? If we needed to recruit medical staff, nursing, we had a significant number of agency nurses that were working with us left over from COVID, even higher than 70 or 75 nurses that were on agency contracts. We knew we needed to recruit nurses. We knew we needed to recruit doctors. What could we learn about growing people from what we already are knowing about growing plants? So we're an agricultural community in an agricultural state, and we use those analogies. And so we dove into this with a tool that Dr. Dave Schmitz from the University of North Dakota School of Medicine calls the community APGAR, born out of or framed after the concept around a newborn APGAR score, which is a newborn's readiness to thrive coming out of birth, beginning of life. With the community APGAR is 50 categories or 50 criteria rather in 5 classes or categories. And those categories are geographic, economic, scope of practice, medical support, and hospital and community support. And it's basically measuring a community's readiness to recruit and retain doctors, nurses, and others. And so we interviewed a group of doctors and nurses and asked them what it was like to live and work here. And we took their answers or that data and we cross-analyzed it or put it through a lens, rather, of the 4 principles of soil health, which were born out of the Dust Bowl and the Great Depression. The United States Department of Agriculture put these together to prevent something like the Dust Bowl from ever happening again. And those four principles apply also with people. So maximize living roots, that's take care of your existing people. Minimize disturbance, address the stuff that's running them off. Maximize biodiversity, simple. Remove bio, and what's the organization's holistic view on diversity, including but not only race, but gender and geography and lived experiences. What's the organization's holistic view on that? And then lastly is maximize soil cover, which is essentially the innovation that happens in between harvest, making sure we don't let what we have just blow away. So we took a look at that. Here's just some high level data that we would share with you regarding what we learned from those doctors and nurses that we interviewed. When we looked at the categories for advantages, our greatest advantages were access to a larger community, benefits, schools, social networking, and emergency room coverage. We have a really robust emergency room that sees some of the sickest people in the region. It's a high capacity emergency room, which nurses and doctors saw as an advantage as far as the scope of practice. Three of these five had really nothing to do. Four of these five had nothing to do with the management of the hospital. When you look at the challenges, perception of quality, daycare, negative perception, hospital leadership and management, nursing workforce, specialist availability, recreational opportunities, four of those seven had much to do with hospital management support. Our greatest challenges were things we could control, and our greatest advantages were broader and were within the community. So when we looked at what was most important to folks, hospital management, leadership, perception of quality, nursing workforce, physician workforce, those were also our greatest challenges. Those were also some of our greatest challenges. So what was most important to folks was what our greatest challenges were. So the bad news is it's us. The good news is it's us. We can do something about that, but it really comes down ultimately to leadership. So we had to be honest with ourselves. To use the soil analogy, what's it like to grow here? What's the soil like? Is it topsoil? Nutritious? Is it rocky, sandy, yucky stuff? Or is it somewhere in between? And we had to be honest with ourselves that this is the kind of situation we were in. And so we got to work. So when we looked at hospital leadership and management, we implemented a partnership with Dartmouth College and sent a cohort a few years in a row, sent a cohort through Dartmouth College to get an Ivy League education there, and bring those transformational leadership skills back here. So it was in a partnership with Dartmouth that worked for us and worked for them. And those Dartmouth students are now bringing some of that casework back and teaching that casework to our local team members. Health system-wide training on effective evaluation of team members was instituted, led by our HR team. They put together a curriculum for that. We promoted physicians to service line medical directors. We launched learning expeditions to other high performing organizations. We went to Mary Greeley Medical Center in Ames, Iowa. We went to Titus Regional Medical Center in Mount Pleasant, Texas. We went to Arrowhead Stadium and took a look at how the Chiefs win so often, and what that was like, and toured the place. And so we took some learning expeditions there, and then our board governance assessment and succession. We had an assessment done, and some succession happened within the board, really rooted in equity, to make sure that the board really mirrored the organization that we're serving. So that was some areas around hospital leadership and management under nursing workforce. We used full tuition nursing scholarships through our local foundation with a local community college to train new nurses. And we made some modifications to our healthcare benefits package, eliminating out-of-pocket expenses. This was a significant move forward for us. We've seen our turnover rate drop to 12% since this has happened. But essentially, we said if you're going to use our system outside of the emergency room and some GLP-1 drugs, there's a few exceptions. You won't have to pay anything if you use our program here. And we saw significant change or impact based on that. We started cross-training between departments to reduce utilization of low census. We introduced paid maternity and paternity leave, just 6 weeks for moms and dads. Couldn't go to 12, didn't have the resources for that, but we started with 6. Management and leadership training for all charge nurses. Across the organization to ensure that we weren't just taking a high performing nurse and putting them in a management role without equipping them. And then hands-on training in partnership with Children's Colorado. We reopened inpatient pediatrics, but we got some training from them to build the capacity of our nursing workforce. And then we've started funding down payments through a donor, a local donor, started funding down payments for nurses to purchase newly built local homes within the community. So those areas those were all things we did to work on improving the nursing workforce. Under perception of quality, we've seen a 20% reduction in observations from the Joint Commission from 2022 to 2025. Our ED left without being seen rates improved to less than 1% in the middle of really by the middle of 2024, it was already there and all the way through in 2025. And has been there since then. So really 2 solid years, we've averaged under 2% and most of those months even under 1% and left without being seen. Our leapfrog rating improved from an F to a D, and then just even weeks ago, we've improved to a C at this point. So jumped up 2 spots, and we look forward to continue that C to go to a B and then to an A. But we're now up to a C. Our average Google reviews improved from 3.4 to 4.0 as we've really worked on our community perception. We completed our first ever state level Malcolm Baldrige Award application, got the feedback from that, and we strengthened our after action review process in response to Sentinel events. Did that as well, and then organization wide customer service training too. So all of that. 1,400 people trained in customer service, even training the trainers. So we have local folks that can continue to maintain that currently. So it's been a really good addition. So, and then under specialist availability in the physician workforce, 25 medical provider families recruited to the county, 5 more on the way. All of them living here, none of them living outside the community. We set that boundary. Housing bonuses for new recruits, $50,000 for physicians, $30,000 for APPs. Our local foundation agreed to pay those $50,000 bonuses, and they're tied to 3 years of service. So if you come, you're gonna work here for 3 years and automatically work off that front end money that helps you buy a home in the community. So it's been a really big win for our community in that way. We have twice annual physician recruitment, medical provider recruitment events in partnership with the local Chamber of Commerce. We're essentially saying, how would you like to practice with your friends and near your friends to residents and medical students from around the country? Come on out. We'd love to have you. And so they bring their friends. And so each time we've done that, we've signed a half a dozen more providers to our team, and we're coming up on 30 that we've recruited. And that does wonders for a local economy. So just our emergency department going from only one of our physicians living here to all the physicians living here, that's like the Chamber of Commerce recruiting in a business with $5 million in payroll because they're willing to live here. They put their kids in our schools, those types of things. It's really wonderful. So um, all good stuff. We began addressing the vital conditions of what we call the vital conditions of the workforce, or the social determinants of the well-being of the workforce. Um, all good stuff. So we basically started saying, what if we cared about where people lived, if they had a safe place to live, who watched their kids, how they got to work, what they ate, if they could afford health care, what would it do for our folks? And then really even finishing the sentence like, I would have another baby, but dot dot dot. I can't afford the care, or I don't have a place big enough to live, or that type of thing. How would we help them, encourage them to grow families here and to thrive within our community? And so we introduced the benefit plan changes that I mentioned earlier, a zero out of pocket, and the scholarship program, and the parental leave, and the down payment assistance, and even we've set up with a local dealership. You can drop off your car at work and then drop your keys in a box, and they'll service your car, bring it back to you at a 10% discount. And then you don't have to do that on your Saturday morning as a busy mom, running kids around. That costs us nothing to set that up. We just set it up with our local dealership. And then we have a shared PTO pool for people in need. And then we have a safe fund, a small fund that for people in crisis, they can apply for those funds and get help. So it's really an organization that takes good care of its folks. But the results with this are that turnover is down 10.2% year over year since the implementation of these. Our domestic utilization is up from 50 to like closer to 70, 75% in months, closer to 70% for the year. Our actual cost is steady year over year for domestic claims. And we have a steady reduction in the use of contract labor for nursing shifts. In fact, contract labor will be gone by August or by October 1. There will be no more contract nurses in this entire health system of 1,400 FTEs, 1,400 employees. There'll be no more contract nursing here. There's several hundred nurses represented in that are now working here, many living here, and then we've seen a number of medical providers recruited to the community. Lower labor expenses mean are associated with lower locums expenses. So we're dropping the expense for locums. It's gone down significantly since coming out of COVID, and the economic benefit for recruiting these folks to the community between doctors and doctors and APPs. Significant. It's millions of dollars in economic benefit coming into the community. Along those lines, and to help with the benefit piece, we were approached by the YMCA of Greater Wichita about starting a new YMCA in Hutchinson. They had most of the money raised. They needed 10 acres of land from us, and we agreed as a health system to donate the land to them and put up a new $30 million Y. Which our employees now get discounts for going to as an incentive for healthy behavior. This just opened about 3 weeks or a month ago, and it's been really well received. We are growing in our partnership with the Y. We are now halfway through a fundraising effort to raise about $8.5 million for a 3-part childcare center to basically care for our kids. A third of this will be the Cosmosphere Space Museum. We'll have like a mini museum for Kansas's youngest astronauts. It's a STEM center. And a third of this will be for 100 of our employees' kids. And then a third of it will be Horizons Mental Health Center has an early childhood development center there that will care for kids with developmental needs, special needs, and they bill Medicaid directly for that. Anyway, all of that's going to be in the same childcare center over here, and we're about halfway through fundraising for that. But that'll just be immediately east of the YMCA, even walking distance over to the Y. There's a few pictures of what it will look like on the inside. It's all space focused and really fits our profile as a community as we have this Smithsonian affiliated space museum here called the Cosmosphere that the Artemis crew has committed to come and visit in the coming months. So we're excited about that, but our kids will really get exposure to this early on. This is the STEM center that will be inside of it. We're still fundraising for that. We are seeing some improvements from an EBITDA standpoint. We are not yet to break even, but fiscal year 27, we are projecting a 3% positive EBITDA and are on a very steady track to getting there. So want to share with you, that last slide that I gave you was helpful because Elena Longwell called me. She was a physician who's a chief medical officer at another hospital, and she's considering coming to be our inpatient rehab director here. And she approached me and said, "Look, I looked at your audited financials, and man, you were way down there and losing about $21 million back in 2023. And that was the last thing that was posted at the time." She said, "If I'm moving my kids there, I need to know that there's some stability there. And what reassurance can you offer?" I was able to share with her the track that we're on financially and the recovery. She said, "Well, I want to be part of that." And so I think physicians are needing the reassurance that there is stability within a system, that the leadership's going to stay a while. And we were able to offer her that. And she's doing wonderful work here now. She's a hospice medical director. She runs our inpatient rehab unit. She's getting more involved with medical leadership. She's interviewing key positions when they come in. It's really been helpful to have her. The other story I'd share with you just around physician relationships is really more than I'm finding that more than they're after money, more than they're after less call even, or more vacation time, or those types of fringe benefits. What they're after are deep, meaningful, authentic human relationships with other people. And it's so important that physicians and administration have a good relationship, a trusting relationship with each other. And the guy on the left here is Mike Hagley. Dr. Hagley is an interventional cardiologist here, trained at Washington University in St. Louis. He's a brilliant guy, really good clinician, great reputation in the region, and continues to be going strong into his mid 60s, practicing with us. He's also on the board. We've got a special relationship. But early on in my time here, he invited me over to his house, and at which point I learned, he said, "Come over in workout clothes." I got over and then learned that he was actually a black belt in jujitsu and quite an accomplished martial artist. And he said, "I'd like you to get on your back on the mat." And I thought, my goodness, what have I gotten myself into? And he gets over me in what's called the guard position, as I'm down on my back. And he said, "Here's my chance to choke out an administrator." And I remember thinking, um, whoa, I am certainly in an interesting situation now. Never been here before. But what he proceeded to show me in the coming weeks and months as we went over to his house on Saturdays was not the exercise of force, but the exercise of restraint. He was showing me how to put his body into locks and moves that could have permanently injured him. But he was choosing to trust me that I would not overexert that force and therefore hurt him. Now, obviously, I don't want to be hurting another person, certainly not the lead interventional cardiologist at our hospital, but he also put me in those situations where I was locked up by him, and really I could have not have gotten out. And out of that came a trust that was accelerated or developed in a way that could have never been done through group team building or retreats or therapies or whatever. I mean, like it was really just an amazing experience that solidified what will be a lifelong friendship with him. And we are on the opposite sides of the healthcare spectrum in that he's trying to figure out how to provide patient care to vulnerable patients, and I have to figure out how to pay for it. And we both understand that the system isn't perfect, and that we're working together on it. And it's so important that we do that. But I think it's really important to have those relationships because they can come with outcomes. So as I mentioned earlier, our left without being seen rate has significantly dropped since June of 2024. Our audit ready financials they're ready for audit in 2025. Really, by the first month of the next fiscal year, our two of our leaders were featured in Becker's Healthcare as one of 50 innovation sites in 50 states around workforce. Um, we're currently in compliance with our bondholder forbearance agreement, which we were under a year and a half ago. We've had new medical providers moving to our county. Our team member engagement scores have increased from 7.4 to 7.9, and 65% of our domestic utilization of our team member health insurance plan, it's jumped up from 50 to 65 in some months as high as north of 70%. So all those are really, really good indications of moving forward. So just some takeaways I'd leave with you is identify the right thing to do by asking good questions of the people most impacted by that thing. So start asking the right questions. And then once you determine what the right thing is to do, hack the system, bootleg the funding, do the right thing, find a way to get it done. But it starts with leadership saying, "But we're going to do the right thing. We're going to do the right thing. How are we going to do it?" Third is track the outcomes for doing the right thing. Track them, meticulously track them so you can prove you're doing it. And then fourth is leverage the outcomes, tell that story, use that story to scale it, to change policy internally in an organization, to change policy at state and federal levels, to change insurance payment for doing the right thing. Back to the agricultural analogy, we can't change the weather, but there's a lot we can do to weather it. We can't change the weather. There's a lot we can do to weather it. And we largely have control of our own destiny. It's easy to slip back into, gosh, this is hard. No one's making money. It's getting harder every year. It's stressful. There's burnout. There's this, there's that. Pause and just say, no, we can do this. We can till the soil. We can get the bad stuff out, put the good stuff in. We can determine our own outcome. We can do this and we'll do it together. So with that, I want to thank you all for your time. Here's my contact information. If you ever want to find me on LinkedIn, feel free to do that. Very much appreciate staying in touch with all of you, and thank you for the difference you're making in your own organizations.